What I see in all the students I teach is the passion. They wouldn't be here if they didn't have the passion to actually want to go out and fix healthcare. Many of them already work in healthcare and they see the challenges and they see the problems and they want to be better managers and leaders.
I think I actually got into the MHA program more so selfishly to think of how can I better whatever community I land in. And learning what I've learned at the MHA so far is definitely something that I can go forward wherever I land to try and make that healthcare system work for the community that I'm in as best as I can.
The MHA program is a partnership between the Tech School of Business and the Geisel School of Medicine. The Geisel School of Medicine brings a lot of expertise in health policy, in health economics, in health data, and the business school brings the best of management education, including organizational behavior topics, finance, accounting.
I was at the point of my career where I wanted some formal education in this space, and this program offered me the opportunity to learn while working full-time and being able to apply my learnings into my everyday work.
We've designed the MHA program to be accessible. So because a lot of it is online, you can be engaging with the program from wherever you live. We also want it to be very personal and transformative, which means that we need to engage with you here. And that's why we have 2 important residential sessions in which you're here interacting in person with faculty and especially with your peers. Between the 2 of them, the residential sessions and the online sessions, we're able to, I think, bring people in from all over the country, as well as to really engage with you on a very intimate and personal level.
There are a lot of other MHA programs out there, and not all of them have cohorts, not all of them have the opportunity to meet and really connect. That's one of the reasons that I picked Dartmouth's program over another program, was knowing the diversity of experience that was going to be here. Having real life scenarios and real life experiences that are shared with people in all walks of life will help me apply the principles that we're learning in class that I don't necessarily get exposed to every day.
I think we all come from such different backgrounds and also life experiences, which makes us have more critical discussions, whether they're during our live sessions, our discussion posts, or just chatting with them, when we're here at our residential periods.
My favorite part of the program is our study groups. We get to know each other on more of a personal level. So we get to learn about, what are you doing at work? What are some of the projects that you're working on? And so I've been able to really build those close relationships through the study groups.
I think I've taken so much back from my MHA so far. I think I've really been able to practice a critical thinking skill and analysis that I don't always get to do on a day-to-day at my job, which has definitely then allowed me to be more confident, more well-spoken and articulate with the clients as well as people above me at work.
We all need healthcare, and I think that if more of us aren't moving up in the ranks and aren't helping reshape it, it's not going to look the way it should.
I think it sounds a lot to think you're going to change the world after one master's degree, but if I can make a change in the community that I'm in with what I've learned here, I feel like I've made a pretty big difference.